Pharmacy benefit managers don't reveal to either health insurance companies or patients or pharmacies exactly who's getting what deal, and they make money at every step of the process. They pocket money from drug manufacturers, they pocket money from pharmacies, they pocket money from health insurance plans, and nobody knows if they're actually driving down the cost. Mr. Duane, you own Panama Pharmacy. What kinds of things can your shoppers buy besides prescription medicine at your pharmacy?
We have a selection of medical supplies and over-the-counter type items for treating simple illnesses, vitamins.
Let's say a shopper needs vitamins. How does this shopper know how much the vitamins are going to cost?
Yeah, we have prices on our shelf tags.
They can see the price they'll pay.
That's right.
It's just printed right there on the shelf. They can comparison shop. They can choose. They go to the register, and that's what they're charged.
That's correct.
Now, let's say this shopper, in addition to vitamins, also needs to fill a prescription. Can they look at a price tag on a shelf, on a kiosk, to find out how much they're paying for the medication?
No, ma'am, there's nothing like that.
So how do they get that information?
Well, they could ask me, and sometimes they do, and I tell them what their insurance is charging them. I suppose they could call their insurance company and ask them as well, but for most people, I think it's just unknown.
Does every consumer who buys vitamins, who buys the same jar of vitamins, pay the same price?
Yeah, in my pharmacy, the price is the price, so that's right.
You don't eyeball consumers and decide who has Aetna and who has Humana, and then the vitamins cost a different amount?
No, ma'am, we don't do that.
There's not differential pricing for melatonin based on whether they're being ripped off by Aetna or ripped off by United Healthcare.
That's correct.
But what happens if I go to fill a prescription at your pharmacy? Does every customer pay the same price?
No.
Why not?
Well, I mean, it's because of the insurance company that's paying for their drugs.
And who negotiates with the insurance company about whether those drugs are covered and at what price?
Yeah, oftentimes the insurance companies themselves negotiate with the manufacturers of the drugs, and that's how they come up with the price that will be charged to the patient.
Then what do pharmacy benefit managers do?
They purport to do that.
Explain.
Pharmacy benefit managers argue that they work with pharma in order to negotiate the best discounts. In my opinion, I'm not sure that you can. It sounds like they're talking out of both sides of their mouth when they say you have to have us in order to lower drug costs, but oh, by the way, drug costs have been completely and utterly unaffordable in the same amount of time.
Well, so pharmacy benefit managers, though, they say that they're negotiating prices. Where can I go to learn how much they're saving us? Saving me, saving our country? Where do I go to find this information to quantify this purported good that they're doing?
I haven't seen anything publicly available that reports that.
Me neither. I believe that there was a time that pharmacy benefit managers maybe did save some money along the way. And I think that's why health insurance companies gobbled them up. Because now they can profit twice. They can profit once as Big Pharma, as the health insurance company, as Big Pharma, as drug manufacturers, and they can profit again as pharmacy benefit managers. Mr. Isaiah, what do you think of this theory?
I think that it depends on which payer. I think in Medicare, we do actually get that information. We know what the prices are, and we know that they're saving us money, and that's why CBO gives us a score that says if you take them away, prices go up.
But why couldn't Medicare just negotiate?
Why
do I need to hire? Is there something like special, like oil you get rubbed on you when you become a pharmacy benefit manager that you're able to drive a bargain that our government officials can't do?
Absolutely not, except that when Part D was created, it was created with in the law it said, you cannot negotiate.
So Congress created this beast.
That's exactly right.
And it would now be on Congress to rein it back in.
That's right.
Mr. Duane, do you think that PBMs always negotiate a better price than your customers would have paid without insurance?
No, I don't think so. I think that the fact that there are so many discount card programs and cash pay programs are evident of that.
I mean, I've actually asked how much it costs with insurance, gasped in dismay, and then had the pharmacist suggest that I walk over and get a little plastic GoodRx card. And I have heard from other constituents who do that. Since my first term in Congress, I have introduced legislation to get full pricing information to patients without them having to ask. We can't stop PBMs from gouging us until we have the information we need to hold them accountable. Some of that information is upside to what they're actually negotiating in terms of savings, but some of it is down to the consumer. In 2 Congresses, I haven't had a single Republican join my Lowest Prices for Patients Act, which would require patients to be told whether it was cheaper to get the drug without insurance. I'd like to invite any of my colleagues to join me in that legislation. This has been a great showing of bipartisanship, Mr. Comer, but I think we need to deliver solutions together as well.